Welcome, everyone. My name is Wiley Cash. I'm the alumni, author, and residence here at the University of North Carolina, Asheville. This is our second lecture as part of the Common Word Community Read here at the University of North Carolina, Asheville. This program has been designed to bring the entire university community together around the reading of a shared text. And this semester, that text is Caste, The Origins of Our Discontents by Isabel Wilkerson. Our first lecture, which was last month, was given by history professor Dr. Ellen Holmes Pearson, and it was titled A Degraded Caste, Color and Legal Status in the Early American Republic. Our final lecture, which will be given November 16th by Dr. Shawn N. Mendez, assistant professor of sociology, is titled Beyond the Binary, Gender, Sexuality, and Family in the American Caste System. Today's lecture is titled Race Towards an Early Grave, How the American System of Ranking Human Value Drives Consequential Health Outcomes. And it will be given by Dr. Fabrice Julien, who is an assistant professor of health and wellness here at the university. If you have questions, please leave them on the video chat, or the folks who are here can ask them in person. With an interdisciplinary background based in social medicine, public health, political science, and sociology, Dr. Fabrice Julien is a sought-after researcher, scholar, and educator. His T-shaped training in health disparities enables him to move across domains and speak to several disciplines. Dr. Julien's research interests include the stress process perspective, immigrant health, adolescent mental health, race and discrimination, global health, aging, and social stratification and mobility. An advocate for transformational science, he is trained as a quantitative social scientist and regularly participates in community-based participatory research. He was previously funded by the Agency for Healthcare Research and Quality as a pre-doctoral health services researcher. He regularly presents his research nationally and is an active member in several cross-disciplinary organizations. Most recently, his work can be read in Research in the Sociology of Healthcare. Dr. Julien is a native of Port-au-Prince, Haiti, and spent his formative years in the metro Atlanta area. He and his wife, Carissa, a faculty physician who specializes in geriatrics, live in the Asheville metropolitan area. We are so excited to have him here today. Dr. Julien.
Thank you to Wiley and the Office of Advancement for this opportunity to present on what is such an important text. That's a true privilege. I have the pleasure of teaching in the Health and Wellness Department here at UNCA. And one of the classes that I teach is research methods. Now, in research methods, my students are tasked with creating a research proposal from scratch. They begin with the topic they're interested in, and throughout the semester they build upon this, formulating research questions, hypotheses, and even designing their own methods section. Now, an important topic that we come to in the course is that of operationalization. Operationalization refers to the process of turning abstract concepts into measurable observations. It's essentially spelling out precisely how a concept will be measured. Operationalization is an important term to know and understand when reading the work of Isabel Wilkerson. Understanding caste requires operationalizing the term to better understand how it operates in modern society. Wilkerson defines caste as an artificial, arbitrary, and often random graded ranking of human value in a society. She notes that caste determines one's standing and respect, as well as the benefit of doubt we receive, and, importantly, the access to resources that they have. Now, the originating caste system in the world, from India, provides some insight into the rigid hierarchy, structured, pun intended, by rules and standards that are, for lack of a better expression, inescapable. And as a medical sociologist, this has always fascinated me. Now, exploring the outcomes of such a system and being left with no solution as to how to remedy it. Impressively, Wilkerson references and delves into various caste-like systems around the world to illustrate that our present system here in America is a derivative. And at times, she argues, the inspiration of contemporary caste-like systems. So back to operationalization. Wilkerson poignantly describes that if caste should be seen as the bones, then race is the skin. And so what is meant by this is that caste is operated through race. That race is the mechanism by which caste systems are maintained and upheld. Race is the operationalized representation of the broader construct of caste. But Wilkerson goes a step further and offers that class is a third descriptor in this, and the only of the three constructs that individuals are not supposedly restricted to. Because social mobility remains an argument for why this particular nation is so unique. But I often wonder, is there truth to this? Wilkerson notes that if you can act your way out of it, it's class, and if you cannot act your way out of it, it's caste. I wish to make the argument that the privilege of acting your way out of it is something that has never been afforded to the American untouchables, or Dalits, individuals of color. But we have to ask, how did it come to this? Answering this question requires a look back at how America has maintained its own caste system. A system that began in Jamestown where a hierarchy was established among the English settlers, those enslaved, and the Native Americans. Now, the assignment of an untouchable class was reinforced as other settlers from various European nations would arrive in the Americas while being provided the explanation of the hierarchy that these individuals are below. And so America, throughout the centuries, has been a conscious experiment, one could argue, on how to maintain this dominant group. Now, in the beginning, the hierarchy may have differed with different categories between members of the untouchable caste and those within the dominant group. But as time has progressed, a conflation took place in members, in those in contrast to the untouchable class, experienced the privileges of being added into the dominant group, essentially becoming honorary whites. Now, a great example of this speaks to the Irish and Italian ethnic groups who would go on to gain membership into the recognized dominant group. So with all of this said, and with approaching this from a health standpoint, what are the consequences of maintaining a status quo where one's standing and respect is not recognized, where they do not receive the benefit of the doubt, and importantly, where access to care is not a focus? Well, as you can suspect, the consequence of this are disparate health outcomes. Happily, and perhaps the better word is importantly, ignoring the notion of agency's role in this, I want to focus on how structure has driven these outcomes. It's what I'm trained to look into. And to do this, we need to look at the health outcomes that exist today for the American Dalits. Three particular indicators are helpful in painting a picture of the disparities in health outcomes within American society. They include infant mortality, life expectancy, and age-adjusted death rates. Now, exploring each of these indicators, we find stark differences between the members of the dominant group and those whose human value rankings are lower, considered inferior. For example, in recent years, the infant mortality rate, which reflects the number of infants in a population who die before their first birthday per 1,000 live births, that infant mortality rate among African Americans was double the rate among whites. Comparatively speaking, 11.1 per 1,000 live births to 5.06. Moving now to life expectancy, which reflects the average number of years a person is expected to live based on current mortality rates. We see a furthering of this trend. Though the average life expectancy in the United States pre-pandemic has risen overall, the differential outcomes have been observed between African Americans and their white counterparts. In recent years, African Americans have had a reported life expectancy of 72 years compared to their white counterparts at 76.5 years. And for women, a similar difference can be seen with African American women reporting 78.1 years compared to that of 81.1 for white women. Now, interestingly enough, the pandemic has widened this gap. Between 2019 and 2020, Black Americans saw an overall decrease of 2.9 years in life expectancy compared to whites who experienced a decline of about 1.2 years. The third indicator is age-adjusted mortality rates, which captures population deaths due to all causes, especially those not due to old age. Now, for age-adjusted mortality rates, high death rate signifies that a population faces serious threats and lacks the resources needed to address them. Now, in recent years, the age-adjusted death rate for African Americans is 858.1 per 100,000 compared to 729.1 for white counterparts, again demonstrating that those of technical lower caste status bear the largest burden. So, what has driven the outcomes mentioned? Well, when you go back to Wilkerson's definition of caste, again you see the mention of one standing they respect, the benefit of a doubt that they receive, as well as access to resources that they may have. And so if we focus on each of these, it becomes clear how these outcomes have remained as such. Now, if caste is to determine one's standing in respect, in the respect that's associated with this standing, then we know that value must be assigned to its operationalized form, this being race. One's standing and respect can be taken to reflect their socioeconomic standing and any associated mistreatment they encounter throughout the life course. Now, the literature and science are clear about the linkage between socioeconomic status and health outcomes. But similarly, the literature is also clear about the deleterious effects on both physical and mental health that mistreatment yields. Now, we know that, for example, mistreatment may be associated with negative and physical health outcomes that include depression, anxiety, distress, hypertension, and high blood pressure. And that as a stressor, mistreatment can broadly impact health in ways that leave those with increased vulnerabilities to develop illnesses. Now, in a seminal piece, Pascoe and Richmond speak on the wear and tear of this process and essentially the wear and tear that it produces on the body and how adverse health outcomes are to be expected for anyone who goes through this without the necessary buffers or resources in place. It should not be surprising then to argue that membership into such a system influences and threatens health across the life course. On the important issue of access to resources, it's important to consider healthcare. Research from the Kaiser Family Foundation has shown that while those most vulnerable and most akin to the American equivalent of untouchable status had gains early last decade due to the adoption and rollout of the Affordable Care Act, but that those coverage gains began to reverse in 2017, coinciding with the election of an individual whose rhetoric was for upholding the caste-like system that has pervaded American society for centuries. And so I would argue that this is not a coincidence. Now, the research from Kaiser also notes that compared to their white counterparts, persons of color, in particular blacks, remained more likely to lack health insurance. And that access to health insurance, we know, makes a key difference in whether, when, and where individuals get medical care. And can help determine how healthy they are. And so in the end, it's clear that if one's membership into a group because of a caste-based system precludes their access to salubrious, health-enhancing resources, then consequential outcomes are to be expected. Now, I want to address some critics. There are those who oppose the notion that there is an American caste-based system. And it's important for me to address what I consider an important American myth. Those who challenge the notion of American caste point to the suggestion that America is a place of opportunity where one can be born to humble beginnings only to reach opulence if they just try, citing more on the side of agency and structure. This is an idea rooted in social mobility, suggesting that no one is resigned to a particular class or position, and that pulling oneself up by their own bootstraps is a reality for most Americans. Often we hear of the exceptions. Those who truly did rise out of poverty, perhaps, and landed themselves in positions of better fortune. Now these, statistically speaking, are rare occurrences and are used to promote the idea that it is possible and that a failure of achievement likely speaks to a failure of effort. From a data standpoint, this position is troubling. Generalizing the reality of one to a group of individuals feels incredibly dangerous. Now, Dr. Fabian Pfeffer at the University of Michigan challenges all of these notions and states that perhaps our conception of upward mobility in the United States is not a reality. Dr. Pfeffer calls it a myth. And his reasoning for assigning it that label from data-driven comparative analyses conducted suggests that mobility is more fixed than it is made out to be, with parental wealth playing a great role in the upward mobility of individuals. Now, by this notion, the American caste system seems to be just as well inescapable. And so Dr. Pfeffer's research is really stating that this idea that mobility is something that is more dynamic is not really reflected in the data. Parental wealth does end up playing a significant role in the mobility of those within the family. And so when we explore this notion, we see that the intergenerational effects of one's positions are more difficult to shape or to break free from. And Wilkerson herself acknowledges this throughout the text, noting the successful intent with caste, that of policing boundaries. And so the caste system really ends up being this well-oiled machine designed for the maintenance of the status quo. Now, the status quo is the positioning of those who are darker by skin, the operationalized metric of caste, into subservient positions and roles, and for the elevation of only those who are fairer by tone. And one of the things I find most fascinating about the important work from Wilkerson is the international comparisons made in the text. And these, I believe, help to better explain the caste system that we have here in the U.S. Now, Wilkerson focuses primarily on three societies, though others are referenced. And three main societies focused on are India, Germany, and the United States. And all three of these societies, as they relate to caste systems, have a commonality of dehumanization and the pursuit of purity. In India, Wilkerson describes how water has been policed, with those of the four main caste groups, Vernas, having greater access to private wells than the Dalits. And when we go back and look at some of the infectious disease data for waterborne pathogens that takes place, we see that a particular class of people end up bearing the burden of those diseases. In Germany, water has also been policed, and Wilkerson describes this with the introduction of separate pools in an effort to maintain racial purity. And fascinatingly enough, Wilkerson notes how this is a Jim Crow tactic that the Germans learned from us. And in the third society, America, the policing of Lake Michigan, where a black boy waded in the water and was lynched as a result, which began a series of race riots. It's difficult to go through these examples and to not draw the conclusion that caste systems are consequential and that the mechanisms by which they operate are deleterious. Now, in the end, caste, it's important for us to consider caste is, or to recognize that caste is within the DNA of American society. But does that suggest, if we are to accept this notion, that health disparities are here to stay, that the health disparities that we see are inescapable? It's a cynical question, and not one that I have a response to. But to reference what Wilkerson notes in the epilogue, it's going to have to be up to the members of the dominant caste, because ultimately the elimination of a caste system is the right step towards achieving equity. Is this possible? Or are we doomed to see growth in the health outcomes and health disparities that we currently see. I do not have the answer to this, but beginning this conversation, having this conversation, recognizing the way that castes are operationalized, being aware of this, I believe is ultimately to contribute to the elimination of such a system.
I have a question, if you'll indulge me. When you talked about standing, respect, and the effects of mistreatment, specifically wear and tear, can you talk about some examples of wear and tear that may not be obvious in day-to-day life to everyone?
Absolutely, thank you. That's a great question. Wear and tear, in the stress literature, refers to allostatic load and how experiences of discriminatory experiences, experiences of mistreatment that one encounters is ultimately helping to essentially progress the deterioration of their functioning within, and so harming their physical health. An important consideration of this is also mental health, and wear and tear. When we think about this from a life course perspective, and someone having to continuously, or a group of people being resigned to such mistreatment, that is going to increase or worsen the psychological well-being of those individuals, and so we'll see deterioration of depression, anxiety, and life satisfaction.
Things like food deserts, specifically access to healthcare. Yeah. And I want to go back. I have one more question about water. I'm thinking about how water is policed, but also in thinking about wear and tear, how water is used as kind of a dividing line. We talk about waterborne pathogens, and I know that in eastern North Carolina, hog farming in black communities and the effects of hog farming in black communities is drawing incredible disparities in health outcomes. Can you talk about like water on an industrial, economic level affecting health outcomes? Is that something that you've come across? Or
That's a really interesting question. So water at an industrial level affecting health outcomes. I think the most recent example that we have is Flint, ongoing issues there, and how that probably would have been taken care of had it been a community that had a higher, income earning population. And so we certainly see it there. These communities are not necessarily consulted as far as the installation of a pipeline. The information isn't given, and as a result, it's an exploitation by lack of disclosure. So, any questions online? Or yes.
Thank you for the presentation, for the conversation. It's important, and I appreciate your time on this. I was curious, you mentioned some historical examples in Germany and India around caste and around the ideas of how they kind of enforce those castes. And I'm curious if there is an example of a society or a culture that has had that system, then moved away from it, and kind of what they did in order to address those castes.
Yeah, It's a great question. Thank you. And I left the text feeling as if Wilkerson was really trying to say that there's a lot that we can learn from the German system and how they've moved away from this caste system. I do have some issues with that because I don't think comparing 12 years of the Third Reich to 400 years of this built-in system here in the U.S. is not sure that that's comparable. But yeah, I mean, I think South Africa is referenced, but if we really dig into some of these societies that have had existing caste systems that are starting to move away from it, I don't know that there's a perfect model yet. But I do think Germany is an interesting one, but I do have to just kind of think, compare like with like, in thinking about the number of years, because certainly those 12 years of terror under the Third Reich, led to such injustices and horrors. But here in the U.S., that is more prolonged and unfortunately still going on.
I also wonder, like, jumping off that, if the reckoning in Germany was, the reckoning and the coming to terms with history was more immediate than we've allowed it to be here in the United States. I mean, especially on a national political level in ways that we've never come to terms with here. You know?
Just to build on that too, I wonder if it's forced.
Yeah.
There was the loss of identity and
sure,
a lot of lives around the Second World War, and so I wonder if there was almost
a forced contrition.
Yeah.
It's fascinating to think about how in Germany, and I think Wilkerson notes this, how kind of right in the middle of in Berlin, I believe, you have this massive structure dedicated to honoring all the lives that were lost, but there isn't a descriptor provided anywhere. It's just kind of right there. And just the juxtaposition of that to what we've seen here, particularly in the South, with some statues still being around, and for the language and the words to still be assigned to those statues too, that are promoting, I guess, just the wrong side of history. It's a fascinating contrast.
Thank you so much, Dr. Julien. That was fascinating, and I really appreciate how much you walked us through the text, through Wilkerson's text, and brought your own ideas and these fact-based studies along with it. That was just fascinating. So thank you everybody here in person for joining us. For folks online, maybe you sat at your desk and had lunch. Maybe you were driving and put your phone on your seat but didn't look and just listened. I don't know what you did, but wherever you are, thank you for joining us. I hope you did so safely. I hope you learned something and saw this text anew, and I certainly did. And I hope that you will come back and that you will join us again, whether in person or online as you did today. Bring friends with you for our lecture that will be in November, and it is titled Beyond the Binary, Gender, Sexuality, and Family in the American Caste System. It will be given by Dr. Shawn Mendez, and that will be on Tuesday, November 16th at noon. So thank you all for joining us today, and I hope that you can join us then. I hope you have a great afternoon here from the University of North Carolina, Asheville.